in the previous class we were discussing about liver function test, and in the liver function test we have seen the liver function test based on the excretory function, which is mainly concerned with the bilirubin, and it is mainly associated with the jaundice. And three types of jaundice we have discussed, and Vandenberg reaction, and how to identify the total bilirubin, conjugated bilirubin and unconjugated bilirubin. I have told you in Vandenberg reaction. Three types of reactions are possible with Vandenberg's reagent. Bilirubin can react with Vandenberg reagent and can give three types of reactions, that is direct positive, which is given by conjugated bilirubin; indirect positive, by the addition of alcohol to the reagent and mixing up with the sample you will get the color, purple color or violet color, then it is indirect positive, so it refers to unconjugated bilirubin. And biphasic reaction, if you see biphasic reaction, both conjugated and unconjugated bilirubin are present. Both conjugated and unconjugated bilirubin are present, so it is total bilirubin, so it is called biphasic reaction. And the type of jaundice associated also we have discussed in the last class. Now we will continue with the synthetic functions. So liver function test based on the synthetic functions of the liver. If you see the synthetic functions, liver is involved in the synthesis of plasma proteins, in the synthesis of albumin, and it is also involved in the synthesis of protein. So these are the important proteins which are synthesized by the liver cells. So by estimating this protein, plasma protein concentration, by estimating the serum albumin concentration, by doing the prothrombin time test, we can come to know the function of the liver cells. So they help in diagnosis, screening and prognosis of the disease. They help in screening, diagnosis and prognosis of the disease pertaining to liver. So that is why these tests are included in the test based on synthetic function. Okay. So if you see the first parameter, it is serum albumin. So serum albumin, if you see the normal range of the serum albumin, it is 3.5 to 5.0 grams per deciliter. 3.5 to 5.0 grams per deciliter. This is the normal range of albumin. And globulins are also part of the proteins. Now if you see the globulin concentration, it is about 2.5 to 3.5 grams per deciliter. The total proteins normal range is 7 to 9 or 6 to 9 or 7 to 9 grams per deciliter is the normal range of the serum total proteins or plasma proteins. So concentration of plasma proteins in the serum is 6 to 9 or 7 to 9 grams per deciliter. Out of that, serum albumin concentration is 3.5 to 5.0 grams per deciliter, and globulin concentration 2.5 to 3.5 grams per deciliter. And if you see the liver profile, liver function test profile in our lab, we have variety of tests included in liver function test. So among that, the first is bilirubin, which we have dealt already in the last class. So this bilirubin concentration is based on the excretory function of the liver cells. Okay. Now in that we have seen the association of bilirubin with the three types of jaundice we have studied. Now the next parameters in liver function test profile is proteins, total protein, albumin, globulin concentration, albumin globulin ratio, and prothrombin also can be done. So since to make it affordable for the patients, the most important and economic parameters are included in liver function test. So if you see the liver function test profile in our test requisition form in our hospital, the liver function tests include total bilirubin, direct bilirubin, indirect bilirubin, total protein, serum albumin, serum globulins, albumin globulin ratio, then SGOT, SGPT, ALP. So these are the investigations which are present in liver function test profile in our lab requisition form. So out of this, total protein concentration is 729 grams per deciliter and albumin concentration is 3.5 to 5.0 grams per deciliter. Globulin concentration is 2.5 to 3.5 grams per deciliter. And in all chronic diseases, all chronic liver diseases, albumin is decreased. Albumin is decreased. Now albumin globulin ratio is also very important. Normally the albumin concentration is high. You can see in the slide that normal concentration of albumin is 3.5 to 5.0 grams per deciliter, whereas globulin concentration is 2.5 to 3.5 grams per deciliter. So these values indicates that the concentration of albumin is very high compared to the concentration of globulins in the serum or plasma. So if you see the albumin globulin ratio, it comes around 1.5 to 1.5 is to 1 or 2 is to 1, almost greater than 1.5 it is. So greater than 1.5 is to 1 is the normal albumin globulin ratio. But this albumin globulin ratio is reversed in case of liver cirrhosis. Then another parameter which is based on synthetic functions we can consider for liver function test is prothrombin time. Prothrombin, you know, it is a protein which is required for the activation of the coagulation cascade reaction. So this prothrombin is very important. By estimating the prothrombin time, we can also have an idea about the liver functions, especially the synthetic functions of liver cells. Now if you see the prothrombin, the half-life of prothrombin is 6 hours and it indicates the present function of liver. So prothrombin indicates the present function of liver. Prolonged means increase in prothrombin time if it is observed in case where more than 80% of the reserve capacity is lost. More than 80% of the reserve capacity is lost for the liver cells, then only there will be prolonged PT time, means prothrombin time is observed.